everyone. Welcome. Please let us know you're here by just typing in the chat, letting us know where you're from. We're really excited for today's training. We'll begin in about a minute or two. We have it action-packed as usual, but we just want to share so much information with you. So we have some great guest speakers today for you to experience the best experience today. Make sure your computer has plenty of power or plug it into a power outlet. Close any unnecessary windows. Welcome, Scott. Welcome, Kaylee from Fresno. Sheila Romero from all of you. Good morning. Use the chat for questions and make sure that it's addressed to all panelists and attendees. If you put it just to the panelists, what happens is everybody else on the call does not see the question. So we really want to make sure in your chat box, if you hit the arrow that says 2, the little blue box 2, and there should be a choice for panelists and attendees. So welcome BART program. Welcome Alicia from Doctors Medical, Trish from Memorial Santa Rosa, and it's Melissa in Lake Charles, Louisiana. Welcome. Happy to see you. All right, we have Josephina from Oakland. Hello. So we have a full house and we're so excited. I'm going to get started, you guys, only because, again, we have a lot to cover. So welcome to our SUN training, Improving and Sustaining Your Program. My name is Sherry Cisneros and I'm the SUN program director. And we're really excited, again, like I said, for today's training. I think you're going to gain lots of information to help you as you navigate your program. So this is really relating to everything about your program. As usual, we are part of Public Health Institute and all of our materials are made under Creative Commons. So today's agenda is sustainability, collecting data to improve your program and promoting your program. Our objectives are outlined here. And I am going to take a minute before we get started with our inspiration and sustainability. I'm going to introduce my boss, our fearless leader of the California Bridge program. She leads us for strategy, organizational development, and policy work. And she is very passionate about our policy work. I'm so excited to present our fearless leader with this whole program change. I just am really honored to introduce our leader, Serena Clayton, Executive Director of California Bridge.
Thank you, Sherry. It's really exciting to be here. This is my first appearance on a SUN training, so I am super excited to be here. Like Sherry said, I oversee all the different aspects of our program, but the area where I have the most hands-on involvement is around sustainability. So that's why I'm here today. I'm just going to talk a little bit about sustainability to kick off this session today. And I'm going to start off by talking about money, and then I'm going to talk a little bit about all of you. So I'm talking about money because essentially at the root, sustainability kind of comes down to money. Somebody has to pay for people's time. So when we're talking about sustaining a program, we're talking about sustaining essentially the SUN position is really the key, because we know that physicians can continue to have the ability to prescribe buprenorphine without necessarily funding them. But without the SUN, they really can't be effective in the way that we've seen happen here with the Bridge program. So I'm going to talk about just 3 buckets or 3 ways of thinking about money. So the first way that a program can be sustained is when there's some big public fund that just says, we're going to pay for this. And that's pretty much the way the Bridge program has been funded up till now. So the original site, if you're one of the first cohort of the first 52 sites, we got money from the feds. The feds gave money to the state, they gave money to us, and they just said, fund the site. So we just paid for the SUN. Then we got the BHPP, the Behavioral Health Pilot Project, and that was similarly, it was just like money to the hospital to pay for the SUN. And now we're hoping that there's going to be a second round of that that's going to continue us for a few more years. So that's a really awesome situation, because someone just said, we're just going to pay for this position. You don't have to do, you can do whatever you need to do to serve the patient. You have flexibility in your role because we've just paid for your role. The downside of it is that that money tends to be unstable, because it tends to be something where people say, we're going to do this for a year, for 2 years, for 3 years, but it's always really susceptible to being cut or just to being a one-time thing. So we're happy to have that money, and we will continue to advocate for that money. It can come from the feds, it can come from the state, it can also come from the county. So there's multiple layers at which a public entity can say, this thing is important, we're just going to pay for it. And believe me, we will continue to fight for those funds. The second kind of bucket of money is around reimbursement. And that's where you actually have to bill for services. So most of you probably don't do this, but maybe in some of your sites you do this, and maybe in partnership with an LCSW or with a physician, but basically it's more of a service by service basis. So when a physician starts a patient on MAT, there's a code and they can bill for it and get reimbursed. So the good thing about that is once you get that going, it doesn't go away, because those reimbursement mechanisms tend to be permanent. The downside is that it's a lot of work. So instead of just being able to do your job, you have to be like tracking what you do. And sometimes you can only bill for certain patients and not all patients. So that mechanism also has its downsides, but we are still pursuing that because we're pursuing all avenues that will sustain this program. And then the third thing is just the institution, like your hospital, your medical staffing group, your health plan. They can just decide to pay for this program. They can just say, this is important. We know it's part of what it takes to run a good hospital, in the same way that hospitals pay for custodial services. Like, that's not a billable service. Everyone just knows that you got to keep your hospital clean. You need custodial services. That's part of the hospital budget. The SUN could be thought of in that way. So that's another avenue that we have less ability to influence that at the state level, but that's something that I want you all to keep in your minds, is that some hospitals have done this. They've just said, we really value the SUN and we're just going to pay for it. So I'm going to now just shift to talking about you, and I'm going to want you to do a little thought experiment, because I think one of the challenges that we have in this field is that people like us who get into this work are often the kind of people who are kind of in it to help other people. We're not trying to like be in the limelight. And so the thought experiment I want you to do is I want you to think about someone you know. We all know someone like this, who is kind of a spotlight hog, like the person who, if they do 2 things, they make it sound like they really did 3 things. They're kind of always talking about how good they are and the great work that they did. Somehow it always ends up being their good idea. So think about that person. There might be not your favorite person. It might be a little bit annoying, but think about the characteristics of that person and think about what they do that causes that attention to get focused on them. Now, we're not all going to transform ourselves into those types of people, but I want you to try to channel a little bit of that personality when you think about your role in sustainability. Because the thing that we can do at the state level is we can look at policies and try to figure out what policies we need to advocate for, and look at reimbursement and try to understand this technical language. But what we need you to do that we cannot do at the state level is really bring visibility to the work that you do. And this is about everybody getting out of their shell and not being afraid to stand up and say, hey, I did this. And our program did this. And we have a lot of tools and ideas in our SUN toolkit about ways that you can do that. But I just want you to think about, how can you make sure that the providers that you work with, the other people in the emergency department, know what you're doing, what your program is accomplishing? Is it sending some emails to people? Is it volunteering to present? We're going to hear later from some of our SUNs that have really stood out in this regard and are presenting and getting the word out in the hospital, but also outside of the hospital in the community. So it's really important, if you get invited to a community presentation, don't think like, oh, that's not really a useful part, not a good use of my time because I should be seeing patients. That presentation is what's going to help people know what you do. That is all part of sustainability. So it is a critical use of your time. I wanted to call out the opioid safety coalitions. There's a network, almost every county has an opioid safety coalition, and we just put the link in the chat. If you are not connected to your opioid safety coalition, you should get connected to it. That is a pretty simple way for you to start to meet people, and most importantly, for people to start to meet you and know who you are and what you do. They have regular meetings. I'm guessing probably a lot of them are on Zoom at this point, but it's a way that you can get connected to other providers and really importantly to the folks in your county, because the county substance use programs they make a lot of decisions about how money gets spent. And there's going to be more money coming into the states because you've probably heard about the opioid settlement dollars. There's also more federal money coming from the Recovery Act. In one way or another, a lot of these monies are going to trickle down to the counties, and the counties are going to be able to decide what they spend it on. So it's really important that they know who you are and what you do. So getting involved in the coalition is one really easy way to do that. And we will be sharing some other tools in the future to help connect you to your counties. And today we're really going to be talking about data, and I'll just give one plug for that, which is when you tell your story, you have kind of two really powerful tools. One is your personal stories, not necessarily about you as an individual, but about the work you do and the patients you serve. The stories that I hear from sons about the patients they've worked with and what they did to help those patients are amazing. As a person who doesn't work in an emergency department, that's not my day-to-day life. And that's not the day-to-day life of policymakers that are making decisions about funding. And so what might seem like, just commonplace to you is really very eye-opening to people that don't live in your world. So sharing your stories and then your data. The data are how is a part of your story. And so that's what we're going to hear about today. So combining those two things, channeling that part of you that's like, I'm going to be in the spotlight. I'm going to spotlight my work. I'm going to spotlight the program because this is how we're going to sustain this program. That's the message I want to leave you with today. And I'm really looking forward to continuing this and helping you all get the word out about what you're doing locally and statewide.
Thank you. Thank you so much, Serena. That was wonderful. It's a really great starting point because we hadn't talked about the opioid coalition list. Rebecca Harris asked, what tools are on the website to make ourselves shine? I think Serena just answered that with your story, and it's in your words. That's something we can't script. What do you say about that, Serena? You've heard many stories.
Yeah, I would say, I think there's kind of two answers to that. Like, yeah, we want to give you some tools. And I think one tool is coming today on this webinar, which is Sherry's going to demo a presentation about Bridge. Because I know this isn't everybody's thing, right? Like, not everybody is comfortable making presentations. And a lot of the reasons that you got hired into the job that you got hired into is not because you were like great at this sort of promotion and public speaking. It's because you were like really good with patients. So we are going to give you some tools. We have some tools in the Sun toolkit in the sustainability section. Really, they're just suggestions, like things that you can do that are pretty simple. Sending emails to people with follow up on what happened to patients. We know that's really powerful for people in the emergency department. But I think also what Sherry said, like those stories that you have, start telling them, just start getting more practice. Obviously, you're not going to compromise any confidentiality, but just start. You can even start by sharing them with your friends and just saying how that goes. Getting practice. You'll see how people react, and I think that will help you figure out how do you need to frame these stories to really have impact.
Great, I like that. And another question: where is the most beneficial to share our stories both with ourselves and about our interaction with patients. To anybody who listens, anybody who asks what you do, how was your day? Explain your day. Like Serena said, we can't encourage you more. When anybody asks, there's a door open, your first words, I had a patient, or let me tell you about a patient I just seen. It speaks miles, and we do that in any forum that there's an open door and a chance to do that.
Can I just share a quick story about that, Sherry? So my first thing I would say, do the easy thing. You know, do whatever you can do that is easy for you, because doing one small easy thing is better than thinking that you've got to do this big presentation to the entire hospital C-suite and then, you know, you never get there. So just do the easy thing. But the story I wanted to share is that one of our directors was trying to get a contact with his Medi-Cal managed care plan, knocking on all the official doors, you know, trying to do the right thing, kind of go through the official channels. But the thing where it actually happened was at a soccer game. So that someone from the hospital is at a soccer game with another parent, started talking, oh, you're the medical director for the Medi-Cal managed care plan. You just never know, right?
Yes, that's so true. That's so true. I think our son mentor Christian has a story like that with Kaiser. So I'll ask him to share that later when he's presenting. So definitely, thank you so much, Serena, for your time. We are honored that you're here with us, and great inspiration to get started. Thank you very much. Next up, moving right along, is John Calico. He is our project manager, and he wanted me to I'm not making fun of him. I got his permission to say he's our resident air fryer expert. So I needed to say that because he takes pride in that. So if you guys, most of you probably have already met John due to his great work. I call him the data guru, and I go to him for everything. He knows that. I'm like, oops, I made a mistake. I want John to come and talk to our sons. So he has a passion. He cares deeply about health and social equity, and he's drawn to our California Bridge mission. In just addressing disparities related to substance use. He has a master's of public health and in business administration from the University of Illinois at Chicago. And now he's here with the California Bridge. And we are so excited to have him because, like I said, he is the go-to guy all the time and helps me out of lots of scary situations because I don't want to say the same thing. John, take it away.
Awesome. Thank you so much, Sherry. Yeah, everyone. So I'm John. I'm a project manager on the data and evaluation team. I also love using the air fryers. So if you also love that, we can talk about that later. But today we're going to go over some of the general questions that come up with data, and specifically for BHPP data submissions. This slide here is actually a translated version of the official data reporting overview that lives on our website. I'm not going to go into all of this in super detail. We'll kind of preview it during today's talk, but I just want to emphasize that all of this information that our comms team translated so nicely onto the slide lives in an official PDF document on our website. So definitely look at that document when you get the chance and be familiar with that if you're not already. So in terms of like a general overview of what BHPP data is, the who, what, where, when, why. So why do we do this? Basically, data is a very tangible way to demonstrate the impact and significance of our program. And so, the aggregate data, which is the what, the monthly aggregate data that you submit to us, the OUD diagnoses, the overdose diagnoses, all of that helps us look at what's sort of happening in terms of numbers and sort of demonstrate to potential funders and other stakeholders, what the value is that you all bring to the program. And so in terms of where this all happens, this all lives in our California Bridge online data portal, which I saw is already being linked in the chat. And in terms of the who and the when, this is all of you, the BHPP sites, and any other sort of California Bridge affiliated hospitals who submit monthly data to us. And the when is, we ask you all to submit these data monthly. And a question that comes up fairly often is, like, is there a hard monthly deadline for the data submission to California Bridge? And there is not. So I just want to make sure that we touch base on that. You know, every site sort of has a different flow in terms of when they can get around to doing their monthly data submissions, just as long as it happens within the month, essentially. So we don't have a hard deadline. It's not like, you know, you have to be done by the 5th at midnight. It's more so whenever you can get around to doing it and doing it well within the month. That's our guidance on terms of the when and the timeline. So what we're going to do today is I'm going to go over these key metrics that you all are reporting on. I'm going to go over some frequently asked questions, and then I'm going to also open the floor for some Q&A with me so that I can hopefully answer some of your own questions about the data. So very generally, the 5 metrics are the first one, which is number of sun encounters. The second one is the aggregate MAT administrations or prescriptions at your site. The third one is the number of overdose diagnoses that happened at your site. The number four, excuse me, is the number of opioid use disorder diagnoses. And then the 5th one is sun encounters that happened while a patient was on a 5150 or 1799 hold. So again, that's very generally what the metrics are. So what I want to do today is go over some frequently asked questions and then again, open up for some Q&A with me. So the first one is, I'm a sun and I get called and I called a patient to schedule their appointment. Is this going to be considered a sun encounter? And so generally for official data reporting guidance, if the conversation is just a scheduling call and you're like, hey, I just want to confirm you're set for your appointment next week, or you do the scheduling and that's it, we would not consider that an official sun encounter. Now, we know that in life, like, conversations often go in unexpected directions. And so if, you determine after a call that, an actual sun encounter happened, which I know does happen for you because you never know what's happening for that patient when you do call them, you might have to make a judgment call and consider that a sun encounter. But generally, if this call is just purely scheduling, we would not consider that like an official encounter for that data metric that I mentioned earlier. Another question I get is, I do a lot of my visits over the phone or through our telehealth platform. Do these count? And yes, regardless of location, these virtual visits are all considered sun encounters. So I just want to make sure that everyone knows that if you're doing a lot of your work digitally, that totally counts as sun encounters for your site. We also get often asked a lot, like, what other data should I be collecting? So in terms of official data to California Bridge, our centers of excellence sites, we do ask them to collect data on a couple additional metrics. However, we don't have official guidance otherwise for you all right now in terms of BHPP data. However, you are encouraged to collect and monitor other relevant data to your site. And we have been working at California Bridge on a list of stuff that might be useful for sites. And so if you're interested in sort of that information, you can reach out to me at my data@CABridge email, and I can sort of send you a list of stuff that other sites have shared with us that are helpful for collecting. And we can go over that, more offline. But, in terms of official reporting, those 5 metrics are what we ask for you all to report to us. The last question I want to go over today is, I report data to my hospital, California Bridge, and other funding sources. How can I stay organized? So in terms of California Bridge data, we do have an internal data tracker tool that is essentially an Excel spreadsheet that can be saved locally to your computer. And that covers the 5 metrics for California Bridge that may be helpful for you in terms of just knowing where your California Bridge data lives. That is not an official data submission. I just want to make sure you know that. And what is an official submission is going through our portal and filling out the information there. However, that tracker that lives locally on your site can be a way for you to stay organized. As well as, if you have questions that come up and you're kind of not sure what's a California Bridge metric or what's my hospital metric, reach out to me and I can definitely help clarify that. And so with that, I do want to open up the floor to Q&A. I know that some of you have specific questions, and so hopefully I can answer them. And if I can't, I'll definitely write them down and get back to you as far as what the answers might be. So I just want to open up the floor for questions for the last few minutes while I'm on.
Thanks. Thank you, John. While we wait for some questions, I really like the fact that you answered the ones that I get the most, and that's about the encounters if they don't have a medical record number in the emergency room, right? They did not get an encounter number. So you're telling us that yes, telehealth, all of those phone calls that have in-depth conversations are going to be counted. So I totally thank you. I will probably repeat that many times. So I really, really appreciate that. Stacy wants to know, would it be possible to share that spreadsheet here? I think she did. It is in the chat. Is there a resource for sons not strong in data analytics to review how to present data to audiences? Definitely, we can make a workshop on that. I can work with John. What do you think, John? That we can kind of, like I said, I rely on people that know this stuff. I'm not an expert. John is, and perhaps maybe in future trainings, John, I would love to see if we could come to a workshop on how to present that. What do you think?
Yeah, absolutely. And I think part of what we're doing today is sort of talking about how data can be used for coming up with stories. And absolutely, I would be more than happy to work on future trainings and looking at using data to back up stuff that you want to say to stakeholders in your site.
Yes, we will put John's email on the chat. Definitely, we will do that. And they just put it down. Data at californiabridge.org is there. We're getting lots of questions. Our ED providers usually diagnose opioid dependence rather than OUD. Should we include those in the metric?
That's from Kyle? I'm just reading here. Okay. Usually provide. Kyle, if you could reach out to me at my email and we can sort of look into that in a little bit more detail. It may count, but it may not. So we can look into that in a little bit more detail.
Okay. Cole asks, where is the best to share our stories? You know, once you have your data sheet, it's nice to, I add a patient story on there. I got that from another son. Like I said, we share ideas. So she submitted her data along with the sheet that had patient follow-up stories right on there. So when you're sending your data to the C-suite, to your performance improvement, add a patient story. It ties into those numbers. You know, data is just the numbers. Kind of connect that with the patient story. So you know, anytime you can share a patient story, that's what I ask. So if you send that email, quick update, here's a patient we just had, want to tell you about this. So definitely, please, you know, share wherever you think. So on the metrics of overdosing, is it just on the opiates?
Yeah, I noticed that question from Rebecca, and I think similarly to Angela. So just in terms of overdose diagnoses, that is not specific to only opiates. So it can be overdose for other substances or stimulants. So that is a really great question.
Yeah, it is.
So in terms of like, when you look at the data overview document, that's pretty much accurate to what it is. So the only time where it's very specific to opioids is the metric for opioid use disorder. Otherwise, you know, we understand that, you know, it's going to be not just opioids. So hopefully that answers your question.
Yeah, that's great, because you know what? I was thinking it was only opioids. So definitely, thank you for clarifying. I think there was one more question about keeping a log of non-BOOP referrals. Yes, keep a log of everything, everybody, all of the patients, definitely. Don't you agree, John?
Yes, absolutely. No, if you have the capacity to collect data on other metrics, that is excellent, and you should definitely keep doing that.
Yeah.
Or consider incorporating that.
Right. It verifies how many patients you're seeing monthly, specifically just not on BOOP. You might only get a few actual buprenorphine patients. So those are always good numbers. One more question, and then we're going to go on to next. If you're seeing a patient for more than 1 day, would you do an initial assessment and the rest would just be a SUN progress note?
So if I'm understanding, maybe it's another way of saying like you sort of see the patient multiple times after their initial visit. It might be the same person. Um, I if essentially if you're continuing to work with that patient and those are official encounters, those would count towards that metric. It's not necessarily like has to be unduplicated patients. These are encounter measures.
Okay, that makes sense. Is there a template of an initial assessment tool? We do have some examples in the Sun Toolkit. Let me look through there and we will get that. There are some tools in our Sun Toolkit, definitely. Do you label? No, it says initial assessment. Really, that's up to how you guys, your facility and your hospital. That's not something that we kind of dictate or guideline. Some sites have actual templates where they're charting like a form. Some sites do progress notes. Some sites do paper. I think that John would say, and correct me, we just want to make sure it's documented somewhere, right? He's nodding his head, yes.
Yes, exactly.
Yes, definitely. And we just put in the chat the toolkit. So there's some resources there definitely for doing an initial assessment. Well, thank you, John. And definitely you're going to come back, right? We're going to do a workshop on how to collect and present this data. So it's a date, John. So I'm going to hold you to it. All right.
Thank you so much.
Thank you, John, for answering questions. This is great. It really clarified a lot of things, and I hope it did for you too. And you have his email and how to connect. So definitely, please, don't hesitate to reach out to us, to other sons, and maybe if you're with, I see Dignity Health, Providence, reach out to other sons and see what they're charting as well. So thanks again, John. So moving on, we have promoting your substance use program. This is all about how our Sun mentors are promoting their programs. So first up, I have one of our favorite Sun mentors. Not that all of them are not our favorites, but you guys know what I mean when I talk about Tommy Trevino. He's going to talk to us today about visibility. Tommy?
Hello, everybody. My name is Tommy. I'm at UC Davis Medical Center in Sacramento, California. Here's a picture of Yvette. She is a new son that came to shadow me. She's in Modesto, Southern Modesto. She stayed 4 days with us here in UC Davis. So when she left, we had her motivated, we had her built up, and she was ready to roll. And I always like people to come shadow us for 3 or 4 days. That way they get a good feeling of how we document and how we approach patients and how we put our program out there. Like Sherry was sharing, like in my hospital, when I come to work, I mean, I say hi to everybody. I say hi to the parking attendants, the janitors, police department, on and on and on. So everybody knows who I am. And when I come to work in the morning, I make my rounds. I stop by the nurse's station, say hi. I stop by the doc boxes and let everybody know I'm here. And that way they know that I'm at work and ready to do my thing. Share stories. I got tons and tons of stories. I don't know, Sherry, you want me to share one but I share stories with our team. I think what Sherry wanted me to share was every Friday I send out an email of a successful encounter with the patient. Like for an example, 1 week I stayed all day with this one young lady and helped her get through some blood work and then Instagram and so on. And then I sent her over to a treatment facility. And 10 hours with this patient one day, there was a lot of people involved, the police department, security guard, nurses, doctors. And the next day I went over and I shared with them and thanked them for helping us out. And I keep them updated. Like yesterday, I let them know that one young lady that we helped out is still in treatment and doing well. So that way everybody feels like they're engaging. And when I do that, I notice that people's attitude changes. They feel like they're doing something, they're helping someone, because everybody's busy in a hospital. Everybody's going 100 miles an hour, and sometimes they forget the great work that they're doing. So I like to share stories with my colleagues. Thank you for listening.
Thanks, Tommy. And I want you to know, Tommy is so visible in Sacramento. Everybody knows him. Everybody, you know, he's just visible. And like I said, that these are from your son mentors, what they did to build their program. And when he's saying, go out to security, go out to anybody that's there in the hospital, because you're building those relationships. So I really thank you very much, Tommy. And he's a great son mentor to shadow. He's shadowed several of you. I see everybody saying hi to Tommy. So thank you so much for sharing. Next up is Christian Hilosian for collaboration. Christian, are you here?
Yeah, hi everyone. Nice to see everyone here. I think there's 110 participants, which is quite amazing. Just a little thing about collaboration. We all should be collaborating with each other. Just before we even get to the slide, we as sons should be collaborating with each other. Tommy and I collaborated on a patient a couple of weeks ago. Part of being a son is establishing this network across the state where, you know, our patients are moving around, and you want to help continue their care. So collaborating with other sons, I think is a big thing here that we can highlight. In terms of collaboration within your hospital and just within your own, I guess, area, recruit a champion. It's probably one of my biggest keys to success as a son, as a hospital, and as a program is you and your hospital champion, whoever that is. It could be a doctor, nurse practitioner, nursing manager, funder, whoever it is. You and that champion should be in lockstep in communication. It will make your life easier. It will make their life easier. And it will ultimately help facilitate and grow your program. Andrew Herring is my hospital champion. He's one of the directors here. He and I literally talk every day. And it doesn't even have to be about the program. It can just be about, you know, how are things going in general with patients, staffing. Should we be expanding? Should we be condensing? Building that relationship with your hospital champion is important. PR, public relations, and marketing, getting the word out, not just within your hospital, but within your community. And that's going to tie into, you know, finding a community outreach liaison is expanding the word, and the program starts with not just offering treatment, but then letting everyone know that treatment is there and they can come in. Bringing people into treatment and passing around word of mouth. I cannot tell you how many people have just come up to me. I heard my friend is in program here. I would like help. I didn't know where to go. And using those community partners who may not be, you know, experienced with medication, but be great with residential treatment or counseling. You can offer the medication and that linkage to care. And they can offer the counseling and therapy services. And, you know, similarly, if you have someone that just walks in, you know where to send them, you know, for other services. And then, yeah, volunteering to give a presentation. So when you make those connections in your community or within your hospital, you know, again, it doesn't have, like Serena said, it doesn't have to be some, you know, 5-hour presentation on like the history of everything and bupe and prescriptions, and it just has to be, this is what we offer. We're here to help you. These are the pathways to coming into care. And, you know, almost simplicity is bliss. If you keep it simple for people, and just be a friendly face and offer treatment, offer pathways for other programs to have patients enter treatment. I think those are major keys to success, and you can eventually build a program that will offer all types of treatment, wraparound care, and many different things that these patients absolutely need. you know, this is a challenging patient population, and we should be there to help them, not just with their substance use disorder, but with everything. So thank you.
Thank you, Christian. I think you brought up a great topic of just networking with our group here. We also offer a community channel with community partners as well. So please, you know, use the resources that we've provided, because it's a great tool to have the more resources for your program and your community. Partner with other with treatment facilities, you know, to do a community event. So I think these are all great topics. Thank you so much, Christian. Really good. Great tips. Okay, next up, we're gonna have a tips from Latoya, our Sun mentor, utilizing resources. Latoya.
Hi. Okay, so utilizing resources, one of the, you know, really key things I want to talk about is words and phrases, which go a long ways as a resource. Using words like fentanyl, overdose crisis, mentioning the 93,000 overdose deaths last year, the 30% increase over overdoses, of overdoses in 2020, or even using recent headline phrases from your area, like that, you know, police video, things like that, can really make an impact when you are doing, you know, community engagement, when you're making your outreach phone calls or in-person meetings, when you're talking with hospital stakeholders, things like that. So use that resource you have. Another thing that I heard of recently was, you know, consistency with a Words Matter campaign. So, you know, that's sharing an email every week with kind of a hot topic on, you know, for example, you know, instead of using heroin user, use person who uses drugs. And then the next week you would talk about something else. So, you know, that's one point. The other one would be to print out and have the Butte protocol or the algorithm, or also known as Quick Start Guide, available. So have it on your person. If you carry a clipboard, keep copies on your clipboard. If you wear a lab coat or scrubs and you have pockets, maybe have a pocket-sized guide on you. But anytime a clinician asks you questions about, you know, dosing amounts, prescription amount, you know, what are the withdrawal symptoms we're looking for, anything related to Butte starts, hand them the protocol. Make that resource the norm for them. That way they have access to that information right there and then. Sharing success stories, you may have noticed it's a pretty consistent hot topic for today. It's been mentioned multiple times. You know, sharing success stories is extremely impactful. Especially for your colleagues, like the nurses, the clinicians you work with, and honestly, any staff member that will listen to you. Success stories come from following up with the patient, or even from, you know, behavior changes, especially if you have someone who's branded as a frequent flyer and comes in, you know, 5 times a month. And after starting buprenorphine and being linked to treatment, they haven't come in 60 days. That would be a success story that I would share with all of the ED team as an example of how, you know, being compassionate and caring and starting them on treatment and linking them to ongoing treatment has made a difference in that person's life. Sharing data also goes along with these success stories. You know, giving people numbers, again, anyone who'll listen. So if this is community outreach, if this is during presentations, if you're talking with, you know, colleagues, clinicians, anything, let them know how you're doing, how your program is doing in your hospital. One of the things that I like to say, especially when somebody, you know, actually stops to talk to me and they're like, hey, Latoya, how's it going? Then I say, I'm doing really great. I've seen 5 patients so far today. How are you doing? To them, they may have no context as to what that means that I've seen 5 patients, but maybe the next time if they tell them, you know what, today's a little bit of a slow day, I've only seen 1 patient today. I'm creating that environment where they're used to hearing those data cues from me. And then also I'll share data in presentations and things like that. Sometimes I'll have a random physician say, how many people have you actually helped in the last year? And I'm like, well, I've helped this many in the last year. If I don't have it memorized, then I have it on my phone and I just look it up really quick. So last but not least, the Sun videos, they are amazing. Some of you have seen them already. If you haven't, I highly encourage that you go and view them, but they make such a big impact on letting people know, the real life in the trenches, people who are doing this job like yourself and myself. It lets everyone else know what we're doing. So they're incredibly touching. You can find these videos on the California Bridge website or even on their YouTube channel. But share those videos. If you have someone asking questions and wants to know more, and they're like, what do you do exactly? And maybe you don't quite have the words to phrase, or you don't even have a moment because you're seeing a patient, say, look up Sun videos on YouTube and through California Bridge, and then they can go and look it up themselves and watch these really touching videos. That's all I have for you.
Thank you. That was great, LaToya. And I think, Serena, are you here? You wanted to add something about the success stories?
Yeah, I wanted to make one comment because one of the things that we're seeing at the state level, at the level of policymakers, is that they don't really understand the patient population that you all are working with. And they often think that sort of simplistic solutions are enough. And so what I want to highlight when you talk about your stories is don't shortchange your role. Don't shortchange the amount of work that you had to put in to get that success story to happen. Okay, so the story is about the patient, but really it should be about you and the program. And maybe sometimes there's power in saying, I serve this many patients. That is definitely a powerful thing to talk about a lot of patients. But I think that what we know is sometimes you take all day to serve 1 patient. And people don't understand that. They don't understand all of the complexities of people's lives and that it might take a whole day to actually make a difference for 1 person. So when you tell your stories, make sure that that complexity is really comes through, that you make it clear what you had to do to actually achieve that success.
Great tips, you guys. I think our Sun Mentor team is just doing a great job. And Serena, thank you for those suggestions. Before I move on to the next subject, I do want to let you know about, there is a question. I'm going to put this to the Suns. I know Highlands Sun works until 5. I have an urgent client. Who should I contact? This is for our community partners. They want to know, what should we do? What should they do after hours for their patient? Can they still send them to the hospital? Type your answers in the chat. Why don't we have you guys do that? Definitely, what should these community partners do? Because it works 2 ways. Not only do they send patients to us, we send patients to them. So, yes, everybody's saying yes, send them to the hospital. The Sun will follow up the next business day. So I'm sorry I missed that question earlier, but I just wanted to know our community partners. We are here. We're developing these relationships and it works both ways. But send them to the ED and the Sun will follow up as soon as they are back. Again, I want to thank all of our panel and all of our Sun mentors. So great suggestions. I hope you understand about your stories. Next up, I'm going to talk really quickly. I think it was more important to hear from our Sun mentors, but we definitely, you can contact me. This is about presenting your substance use program. How do you give a sun presentation in 15 minutes? Well, it's going to be less than that because we're running out of time. But I just wanted to show you a very simple outline of how a presentation in 15 minutes. You can do it at a shift huddle, at a staff meeting. You could do it at a community event, correct? So we just wanted to kind of give you an outline. You want to introduce the California Bridge Model. That's what the actual program is. Our MAP buprenorphine protocols, resources for healthcare providers, especially if you're giving this talk inside the hospital, benefits for special populations, and your role, as well as harm reduction. I want to make sure you guys know we're counting on you to be the harm reduction expert, right? So really, it doesn't mean you have to have a naloxone distribution project. It could be something very simple as you're focusing on reducing stigma. Hand out a flyer with words matter. You saw that on Latoya's presentation in the little corner. Start a Words Matter campaign. That is harm reduction. So please, definitely, again, you are always going to start by, and these slides are going to be available for you to use for your presentations. I will send the slide deck to you. But you always want to talk about the bridge model. It's three focuses. Low barrier treatment is what our physicians, nurse practitioners, and physician assistants are doing. They're giving the treatment to the patient. And the last two are the SUNs, connection to care and community, and culture of harm reduction. That is where you come in, and that's what you can talk about. You're the expert for that. I always talk about what is medication for addiction treatment. You know, substance use is a chronic illness, and that's really something that you are the role model to present to the community, to your staff at the hospital, and really focus that substance use disorder is not a moral failing, that still that stigma is around it. There's medication and it's evidence-based. Very important to clinicians that it's evidence-based. That means it's tried and true, right? We tell them that we give buprenorphine in the emergency room, on discharge, prior to community discharge, it increases rates of linkage to outpatient treatment. And the same thing with inpatient treatment. Buprenorphine controls withdrawal and increases patient to linkage. So you always want to, again, give the facts. You can always give, like I said, we're talking lots about the protocols for buprenorphine. Print them out, hand them out. Your clinicians will love this because they don't like to look up things. They're in a hurry. Remember, they're an emergency. They're being pulled and turned and twisted every single way. So when you're there with your helpful protocol, it makes a world of difference. Other resources are the blueprint for hospital opioid use disorder. That's for administrators really starting the program, and an MAT toolkit for nurses. Remember, we have all of these resources on our California Bridge site, and please share them with your staff, with the community. We also want to make sure that we tell your healthcare providers that there is help. There is a support line 24/7 for anybody, any provider seeking support for treating patients. This is clinician to clinician warm lines. So please make sure, this is a very important slide. The next thing tells about who should get MAT treatment. Well, it benefits all opioid use disorder patients. And OUD can happen in all communities. We already know that. Unfortunately, we know racial disparities exist when it comes to access to MAT. And Black patients are 77% less likely to receive buprenorphine than white patients in the outpatient setting. These are huge numbers, and this really makes a difference and it hits home, because remember, all of our healthcare providers are here to make a change. And again, similar results were found in study of veterans. So really powerful slides. And then talk about, I am the substance use navigator. What do I do? Explain what you do. The slide here is definitely just to remind you, you know what you do. Your process and program may not look like this, but it is just a placeholder to talk about, this is how you contact me, okay? Or I receive a consult, I'm gonna meet with the patient, and then I'm gonna go and talk with the physician and the nurse, and I'm gonna connect patient to care. So again, fit your process with this slide. We always want to provide keys to success. What does success look like? The ED administers buprenorphine. The doctor gives an X-waiver, doctor provides a prescription, and we refer to the substance use navigator with a warm handoff to the treatment center. So always make sure you highlight. This deck will be shared, definitely. And then you always want to get a plug for harm reduction and culture change. Remember I said low barrier treatment is part of the California Bridge model, but harm reduction and culture change is all upon us. And we just want to remind everybody to use destigmatizing your language, right? Use person first language, a person with substance use disorder. So again, this is a great slide. Our comms team works really hard to make, we call it Bridgeify, which means makes it beautiful for presentation. And again, here's a second slide, and we just go over clean and dirty. There's still some stigma about those words. They're being used today on the news. I was really excited. They were talking about a new federal program to give incentives for patients who use drugs. And the news reporter, one of my favorite news reporters, used for drug addicts. And I just cringed because I want to send a note to her saying, don't use that. So again, just remind people and put a story to it, you know, how you first used it. Again, I didn't start harm reduction until probably, I want to honestly say 2.5 years ago when I heard about Bridge. And you can tell your story. And again, these slides, very quick, very simple. Ask if you have any questions. If they'd like any more resources, send them to California Bridge. An ending slide would be great with your name, your contact, and how to reach you, what your after hours process is. So real quickly before we end, I'm trying to meet the wire here. Again, like I said, I always let our Sun mentors and our speakers speak because I think that's the best training ever. But we are going to be having a California Bridge Sun Advisory Council. If you want to make a difference and you have great ideas and suggestions, and we are proud that we're going to initiate a Sun Advisory Council. Our goal is for Suns to represent and express the challenges of the Sun role and develop recommendations to improve patient care. We are in need of 8 Sun volunteers to attend monthly meetings. This is a commitment from September to June. So if you are interested, please email me. Again, scisneros@californiabridge.org by September 10th. We're hoping to get this started at the end of September. Okay, next up, please fill out the evaluation form. I will be receiving a follow-up, sending out a follow-up email as well. And we also are very happy to announce our comms team made this slide beautiful. Again, Bridgeified it. We have translated patient materials for those of you who are asking. We have so many of our documents now in Spanish, Tagalog, Vietnamese, and Chinese. So please use our website to get these translated patient materials. Our team works so hard to translate these for you. So these are just beautiful. And again, print them out. We can't wait for you to use them. Join us on our social media. If you don't know, our special virtual event is for National Overdose Awareness Day is August 31st at 12. It's a half-an-hour program, and we will be honoring those lives lost as well as special speakers. So please sign up. Our next training is coming up September 23rd. It will be about self-promotion and certification with KDAP. Again, our executive director of KDAP, Barbara Ade Garcia, will be back with us. If you missed it, it's great. If you didn't miss it and have follow-up questions, it will be a great time because she will be with us. And so I'm really excited because we are in partnership. And so again, please come September 23rd. I just always want to thank our Sun Mentor team. As you see here, you guys know who your Sun Mentors are: Christian, Rebecca, Latoya, Chaya, Angela, Tommy, and Wendy. Thank you so much. They just do such a great job with providing input for these trainings. And as well as our communication team and John and Serena, I thank you so much. And again, here is my email. I know there was some other questions. We have 1 minute. And there was something, can an X waiver provide follow-up prescription? An X waiver is the only one that can provide a follow-up prescription. That's a discharge prescription. So yes, only an X waiver. Any doctor in the emergency room can administer buprenorphine, but only an X waiver can write a prescription. So I hope that answers that question. Until next time, you guys, I thank you. I hope this was informative. And again, I will send out the slide deck, and the recorded video will be on YouTube, and I will send out a follow-up email with all of the information. Please fill out the evaluation. And until next time, hopefully we'll see you on August 31st, Tuesday, for our National Overdose Awareness Day special event. Thank you.